If you're new, it's Tom. I'm a junior doctor and entrepreneur working in Melbourne. In this video, I'm going to take you through the mapping framework I used in my second and third years at Melbourne University. In those years, we sat OSCEs or clinical exams where you walk in and the doctor is marking you on your history and examination skill taking. And I was fortunate enough to score a perfect mark in most of my history stations. And I attribute to the mapping framework that I used in my study, which I'm going to show you today. I think there are three reasons why the mapping framework works so well and why I did so well using it. The first reason is that there's just a fundamental alignment of incentives. So you're aligning the way that you're studying the resources with the way that you're actually going to retrieve the resources. So rather than a synapse having to take, three different paths like system, presentation, condition, and then to think of another diagnosis, I have to go system, presentation, condition again. It's just presentation, condition. And you're actually studying by remembering all the different conditions that are relevant to a certain presentation. So when you walk into the room in an OSCE, you can literally think of every single condition relevant to that presentation almost immediately. Second, the method of memorizing means that you're actually doing that active retrieval constantly. So that active retrieval is really a key to doing so well. And the third thing is just structure. It means that you have a really clear structure of how you're going to study. You're efficient, you don't waste time because you're studying in a really kind of well-defined set of resources. So the first phase is the mapping phase. Now, in this is where you define the actual sort of hierarchy of your study, how you're actually going to map your study, so to speak. And the first step in doing that is identifying what is that actual functional unit of thought, like what is the categorization that you need to think about when you're studying. So in medicine, it's fairly easy. What do you actually do as a doctor? Well, you see patients that come in with a certain set of symptoms or presentations, and in that, there's a series of diagnoses and conditions that are associated with those presentations. So the kind of core functional unit or the heading, parent structure, whatever you want to call it, is a presentation. And that's how I organize my study. So you can see on the screen now, I've got a sort of parent heading. So I've got presentations, and I've listed underneath the presentations in medicine. So chest pain, shortness of breath, dizziness, numbness. That's the kind of hierarchical structure that makes sense in medicine. So now step two, working into the actual atomic units. So what are the protons and neutrons that make up your atom being the presentation? What are the things that should fall under the presentation? So for me, that was easy. Again, in medicine, the things that fall under presentations are conditions. So under shortness of breath, there might be anxiety, there might be anemia, there might be acute myocardial infarction or heart attack. And this is really useful because in medicine, when you study, basically from the first lecture, they teach you different conditions. Kind of systematically as you study medicine, I was categorizing all of these different conditions into presentations. If you're going presentation and conditions, when a patient comes to you with chest pain, you've already studied all the conditions that relate to that presentation. Whereas if you've studied system like heart, if someone comes in with chest pain, it's not just heart systems that could be causing it. So you actually have extra steps in your brain. Your synapses have to go further. So if there's one thing you take from the mapping phase, it's fundamentally adjust the hierarchy of what you're studying to match how you're going to use the information in a functional way. And I don't know what that is for what you're studying, but for medicine, to me, presentations and conditions makes the most sense. So jumping back into Notion in my example, you can see under chest pain, I've added a few examples of how you might structure it. So you'd add pneumothorax, acute myocardial infarction, reflux, and you can see that these go across systems. So pneumothorax might be studied in respiratory block, acute myocardial infarction might be in cardiology block, and they don't necessarily relate to each other. And this is actually really useful because it means that as you study them independently, you are creating this gigantic map. And as you study lectures and the university covers different topics, you'll actually be constantly revising all of these conditions as you go. Now, I'm not going to go into a bunch of detail about how I actually studied each condition in this video. I would make these one-page documents where I'd write in sort of like the pathophysiology, the treatment, different things you might expect. So hepatorenal systems or reactive arthritis, it's a disease of young men, and what's the presentation like? acute inflammatory, etc., etc. And I would try to keep it really succinct, only one page at a time. But most importantly, I would always include the questions I would ask on history that would give away that this might be the cause, and what I would find on examination. The second phase is the memorization phase. So you now have this perfect mapped hierarchy of how you're actually going to study and learn concepts as you go through your degree. Memorizing, the most effective method that I've found in my studies, and I've studied a lot, is spaced repetition. I spoke about it in my surgical exam video, how I passed my surgical exam. But basically, whatever you study on day one, you make sure that you study it the next day, you study it in a week, you study it in a month, and you study it in 3 months. Kind of key with spaced repetition is not just to read your notes or do something kind of menial. It's actually quite important to do an active recall process. So for every single one of the presentations, remember that parent level, the functional unit, not conditions, for each presentation, like chest pain, I would do spaced repetition. The conditions that fell under chest pain might actually be getting longer and longer as I cover more and more conditions. But each time I reviewed it, I'd be re-reviewing some conditions. Some conditions might be the first time. But that consistent re-reviewing was really the thing that I guess gave me that upper hand in remembering lots of conditions. And that's it. That's how I ranked first in my medical exams using the mapping framework. Like this video, share it with your friends that are in medicine, help them study in the right way, and subscribe to my channel for more great study tips. And yeah, good luck.